Okay, sir.
Okay, thank you, Memon. Unmute. Today we discuss with in last lecture we already discussed the thrombosis. So today we are also discussing a new topic related with the hemodynamic and fluid disorders, the embolism. Embolism is also a clinical condition. They also can be referred. Embolism referred to any intravascular mass, so whether they are the solid, liquid, or the gaseous masses, and they also can be to the blood flow, carried to the blood flow and to a site and distant from its origin. So the most, for example, there is 99% of the also can arises, most probably the embola arising and from the thromba. Okay, so the thromba, so hence in the term they also can be used as a thromboembolism. Thrombosis means formation of the clotted mass of blood. Thrombosis, in last lecture we already discussed the thrombosis, the formation of the clotted mass of blood in the non-interrupted cardiovascular system. And they can occlude the vessel or they also can occlude of the vessel wall. So the embolism, by definition, they refer to any intravascular mass, whether they are solid, liquid, or the gaseous masses, and they can also carried by the blood flow. They can carried to the blood flow and to a site of the distant, the right of the distant, it's to its origin. So the most commonly, the also can be causes Ebola. They also can be caused from 99% and from the thrombi. Okay, rarely they also can be classified on the basis of the type of the thrombi and also the and consistency. Consistency type of Ebola. There are two major type of the Ebola. There the number one, there is systemic embolism, a systemic thromboembolism. Another one is the pulmonary thromboembolism. Today we also can discussing in detail. So the some there is minor form, and depending upon the consistency, they also can divide it into the, we already discussed the definition by the solid, by the liquid, and also are the gases and concentration. So they are the rare forms, and they will also can be including the fat droplets, and gases, and the gas bubbles, and they're also having there the atherosclerotic atherosclerotic debris, and also the other form they also can call as embola, embola, and other types tumor fragments, and also the tumor fragments and bits of the bone marrow and the foreign body like the bullets. So these are the some sources and for development of the embolism. Okay. Now the embola, they also can be lodges in the vessel's wall, and to also to also a small to also can permit the further passage. So they also can be resulting there the resulting in the partial or the complete occlusion or the complete vascular occlusion. Also can be occur, and vascular occlusion, and it is also they also can leading to the can call occlusion of the vessel wall. They can lead to ischemic necrosis, and they also can lead to the formation of infarction. So the infarction is also widespread. There is widespread necrosis of the area of the myocardium. They can lead to the formation of the infarction. Okay, so embola, they also can be lodges in a vessel wall, and to also a small and to also can permit, and they also can permit the further passage, and they also can be resulting there is a partial and complete or complete kabhi kabhi आधा kabhi full complete occlusion of the vessel lumen. They can lead to the ischemic necrosis of the area. They can lead to the infarction occur or development of infarction. Now they're also having the two types, major type, the pulmonary embolism and the systemic embolism. we already discussed um, in the classification, and also the some consistency. Most probably these are the causes. And the pulmonary embolism. Pulmonism, they also can occur in about 0.2 to 0.4% of the hospitalized patients, and they also can causes about the 200,000 death. They also can be occur annually in the United States of America. So they are having there is some greater than 95% of the patients, greater than there is a 95% of the pulmonary embolism, greater than the 95% of a case of the pulmonary embolism. They can also originate and from the deep vein thrombosis, DVT. We already discussed in the thrombosis. DVT is also caused. They also can cause lead to formation of the deep vein thrombosis. And although the DVT, they also can be occurs due to some there the bedridden patients and also the immobilization, and these also can occur three-folds greater. They also can be more roughly three-fold. They also can greater and more common. They also can be more common, and then the most probably pulmonary embolism. इससे ज़्यादा DVT more common है बेटा. ठीक है बेटा, three-fold ज़्यादा common है, and then pulmonary embolism से ज़्यादा most common occurring deep vein thrombosis. Now, there is a pulmonary embolism. Pulmonary embolism, and they also can be cause occlude the they can cause the occlusion of the main pulmonary vessels, main pulmonary artery, and there's impact and across the impact. They also can cause impact across the bifurcation. They can lead to formation of the saddle type of the embolus, and or the they also can and they also can be passed into the and they also can uh, pass into the smaller arterioles. So they also can be see. So there are the pictures of the saddle type of the embola. So this is also a saddle type of the embolus. So this also you can see the main pulmonary arteries also can show the bifurcation, and they can lead to the saddle type of the this is a horseshoe shape होती है, and also the saddle embola. They also can occur in this type of the bifurcation. This is called a saddle embolus. So this is also most probably lung structures. They also having the pulmonary embolism showing. So pulmonary embolism, infarction. Okay, some with the multiple embola. There are multiple embola, and they also can occur either they also can occur either sequentially. They also occur in the sequentially, and or they also can occur as also a shower of the small embola, and from a single single large from a single large mass. ठीक है बेटा, तो ये single large mass उसकी and or in they also can be in the general in a general one, and they will also can general one and general one there is a pulmonary embola, and they will also can put they also can put also put also a some their point of the there also can be point equals to point at the site of the point at the risk of the for the Ebola. Okay, so this is also showing and some another form. There's a recent they are also having there they rarely. So Ebola they will also can be rarely Ebola and pass through pass through the atrial or the ventricular defect. They also can occur rarely. They also can pass through the atrial or the ventricular defect and into the systemic circulation, and they also can lead to the paradoxical. They also can lead to the paradoxical embolism formation. So they also can lead to the paradoxical embolism. And the most pulmonary embolism, most of the pulmonary embolisms, about the 60% to 80% of the cases, and they are small and also they are small and clinically silent होते हैं बेटा. ठीक है, जो most of the pulmonary embola about more than 60 or 80% के दरमियान, and they will also have become clinically they are remain silent. small भी होते हैं. So they eventually they also can be organized, and they will also they can organize and get incorporated and into the into the vessel wall. ठीक है, उसके अंदर चली जाएगी. And or they will also can be leaves there also can be leaves also a delicate bridge, delicate also the bridge fibrous wall banegi. So they also conforming a bridge fibrous. Okay, so in case of the pulmonary embolism, and they also having that there were some complication over here, sudden cardiac death. And these are some complication over the development of the after the pulmonary embolism, sudden cardiac death. They also can occur right-sided heart failure because they also lead to the core pulmonal and they will also can cause a cardiovascular some that they collapse and or collapse they also can occur. And when when 60% or 60% or the more of more of the pulmonary circulation it is also obstructed. जब 60% से ज़्यादा they are also can pulmonary circulation obstructed हो जाएगी, and they will also can leading to the obstructed and with embola. तो ये they also can leading, तो ये complication तब होंगे जब more than 60% जो सर्कुलेशन कोलैप्स हो जाएगी पल्मोनरी एम्बोलिज्म की वजह से, तब ये कॉम्प्लिकेशन डेवलप होते हैं. ठीक है बेटा. सो pulmonary embola, and in most probably in the medium size pulmonary embola they also can occur within the medium size arteries, and they will also can causing the pulmonary most probably pulmonary hemorrhage. They also can lead to pulmonary hemorrhage. Now the pulmonary embola also can occur in the smaller end arterioles, small end arteriolar vessel, and they are typically they will also can causing, and they are also having the hemorrhage and also the infarction develop. Small arteriole के अंदर pulmonary embola चला जाएगा, they will also leading to the pulmonary hemorrhage and the pulmonary infarction की chance होते हैं होने के. ठीक है बेटा. Now this is also all about the pulmonary embolism. Now the occlusion pulmonary thromboembolism, there is the occlusion of the some part of the pulmonary circulation. some part of the pulmonary circulation and by the impaction of the embolus, and which is brought to, which is also can be brought by the which is also can be brought by the some there are the sites brought by the sites brought by the site and uh, through the circulation through the circulation it is also called as the pulmonary thromboembolism. So this is a definition of the pulmonary thromboembolism, occlusion of some part of the pulmonary circulation by the impaction of the by the impaction. Okay, so pulmonary circulation by the impaction of the impaction of the embolus, and which is also brought by the sites and through the circulation, and which also can be known or called as the pulmonary thromboembolism. So the more than 95% of the cases of the thromboembolism, and they will also can be originating and from the deep vein leg, and above the level of the knee. तो ये common site होती है. They also can for development of DVT, the common cause for development of pulmonary and thromboembolisms. So they are also can be these also can be carried and through the and they also can be carried and through the larger progressively larger channels, and usually and they also can usually they also can causing the and causing there the most probably there the causing the causing through the most probably there the okay. Now, so these are the some clinical manifestation we already discussed. There's a large pulmonary, most probably the pulmonary embola, and there's a larger embola, and larger embola, and may also can be lodges, and they also can be occur, and within the within the outflow, they also can occur within outflow tract, and right ventricular of the right ventricular, or in also can occur and within
Continue.
these are the clinical manifestation. There's a massive embola, and the other also having the medium size embola, we already discussed, and some there are the and the small size embolus, and they also can be causing some complication over here, pulmonary hemorrhage, and also some there the infarcts. So they also are leading the small arterioles, and there is a small size embola formation. Okay. Now, what are the most probably the complications of the pulmonary embolism, like a sudden cardiac death, pulmonary hemorrhage, and pulmonary infarction, and also the pulmonary hypertension. These are the most common complication, and after the pulmonary thromboembolism. Now, another type systemic and thromboembolism. So this is also an occlusion of the some part of the systemic arteries, and they also can occur, and due to the detached thrombi, they also can occur detached thrombus, and which also can be originated and within the they also can originated and within the left side of the heart, and also it is also a large artery. The large artery is also can be called as there is a systemic thromboembolism. So the sources also can include number one. So in the patients, and who also in the patients and who also having the infective endocarditis, and there the vegetations, and most probably vegetations and on the and the mitral and the aortic valve. So these are the some sources for development of the systemic thromboembolism. Endocarditis, the formation of vegetations, and they can lead to the formation of the embola. So now some there the in the patients. So in the patients and with the myocardial infarction, in the myocardial infarction, and who also developing the that's who also can be developing the mural thrombus. Okay, they also will lead to the formation of the embola. So in the patients and who also having the metal stenosis, and also having the atrial fibrillations, and who also can develop the chance of the thrombus formation, and within the also can occur within the atrium. So they can lead to formation of the systemic thromboembolism. So the metal valve and aortic valve, they also lead to the. So in patients and who also and the patients and with aortic aneurysm. So patient with aortic aneurysm and the ventricular aneurysms, and who also and which is often they can containing, that's also containing the mural thrombus. So these are the some sources for development of the systemic thromboembolism formation. So they also having some the infective riotous, and also they're leading the vegetations on the head, where they also conformation of the system thromboembolism and myocardial infarction. They can lead to mural thrombus, and the patient who also having the metal stenosis, and they also development of this, and some patients and also having the atrial, also having the an aortic aneurysm and the ventricular aneurysm. They can lead to formation of the systemic thromboembolism formation. Okay, by the infection of the some large number of thrombosis. What are clinical features? So the clinical effects of the systemic thromboembolisms, and they also can be uh, depend upon the they also can be depend upon the size of the they also depend upon the size of the obstructed vessel wall. Okay, vessel wall, and the availability of the collateral circulation. So the collateral circulations, availability of the collateral circulations, and also the and also the susceptibility of the tissue, and they also can become ischemia. So they also have the some factors, and they also can depending upon the, so the clinical manifestation and clinical effects of the systemic thromboembolism, and they will also can depend now on the depending on the size of the obstruction, कितनी size की obstruction होती है बेटा of the vessel wall, and also the availability of the cold circulation. ठीक है बेटा, cold circulation, जिसमें cold circulation दो उसमें कम से कम चांस होते हैं बनस्पत जिसमें cold circulation नहीं है, and also the susceptibility of the tissues, and they also can become ischemic, जिसमें ज़्यादा चांस होता है ischemic होने में. Okay बेटा, and they also having some the infarction. It is also a uh, most common, and when the embola, and they also can be lodges, and they also can be lodges, and they also can occur within the arteries, within the arteries of the, most probably occur in the brain में हो सकता है, in the heart में हो सकता है, kidneys में, and spleen में. These are the most common organs. They also can lead to the formation of infarction. The thromboembolism के बाद they also can development of the infarction. ठीक है बेटा? So they also can call it the systemic thromboembolism, the clinical manifestation or the clinical effects of the systemic thromboembolism. So because of the anatomical condition, anatomy of the distribution of the anatomy of the anatomy of the aorta, some there the cardiac embola, and they also come leading to the some there the lead to the past, and more there's a chance for the most frequency, and the more frequently they also can into the frequently they also can occur into the lower extremities, and the 75%, sorry, 75%, and they also occur in the, and also occur in the brain में, and occur in the 10% of the cases, and there's infarction तो सेल वाले अगर in the brain में वो 10% केस होते हैं, और डीवीटी जो most probably 70% of the cases, 75% of cases they also can occur in the lower extremities मोती चांस. ठीक है बेटा, तो ये infarction in the most part they also can occur in the intestine, in the intestine, and also occur in the lower extremities. Lower extremities, and only they also can occur, and they also can occur and when the large when the large arteries and they will also convey a large arteries, or they also can be occlude. Large arteries also can be occlude or vein. They also can be co-related circulation, and they also in the co-related circulation in these tissues, and they also can occur the compromised. यहाँ कोई tissue जो compromised हो जाए, they also can lead to some less chance for development of infection. Now we also can discussing there is some the paradoxical embolus. Paradoxical ebola, so they also can be having there the ebola, and which also can be they also can enters and into the right side of the heart, enter within the right side of the heart, and also passes through, passes through the, most probably the interarterial interarterial are also occur in the interventricular septum. They also can be interventricular septal defect, and they also can be defect, and they are to gain the, most probably they also can gain access gain access and to the left side of the heart, and they also in left side of heart, and they are also can be called as the left side of heart and the in the atrial system, and they are also can be called as a paradoxical emboli. The Ebola who also can be enters into the right side of the heart, okay, right side of the enters in the right side of the heart, and they also can be passes and through the interarterial interarterial or interventricular septal defect, septal defect, and they also can gain to access and to the left side of the heart, and they also and left side of the heart and the arterial system, they also can be called as a paradoxical ebola. Okay, this is the definition of paradoxical ebola. Now we can also having they depend upon the consistency, and they are the fat droplet, and most probably and another type they the amniotic fluid, most probably the liquid type, and also having the air ebola, the gases form, the solid form, three side. They are also number one, the important fat embolism. Fat embolism, the process and in which the fat globules and may also appear. They also can appear in the they also can appear in, and they can obstructing. They also can be obstruct. They also can be obstruct the circulation and in the various organs of the body. Various organs, they also can be called as a and they also can be called as a fat embola. Okay, what are the most probably common causes they also can producing for development of the fat embola? The first of all, the most probably the fractures of the shaft of the long bones and the ribs, and also some there is trauma to the, and they also can trauma to the adipose tissues, and also them there is a burns. So these are the most important causes, and also having there is the extrinsic fat droplet, and they also having the fat globules, and these are the some sources for development of the fat embolas. So the amniotic fluid embola, this is another type. So it is also micro. It is also having there the major cause for development, major cause of the metal mortality. Okay, so it is the major cause and for development of the metal mortality due to the that's occur during the um, during the labor, and they are which is also can be characterized by the most probably also can characterized by the some sudden development of the dyspnea and the cyanosis, and patient they also have sudden type of dyspnea and cyanosis and the collapse. So these are the some and some there the occur formation of the hemorrhage and convergence and the coma. So these are the some features they also can developing, and after the fluid embola formations. So the mostly amniotic fluid emboli, amniotic fluid emboli, they will also containing prostaglandins. They also containing the prostaglandin, and they also causing, and they also having the causing the pulmonary constriction, and also the pulmonary constriction, and they also can cause there is a thrombogenic. They also can have developing the uh, thrombogenic factors, and they will also can causing, they also can cause there the, they also can causing there the intravascular, that's the development of the intravascular congestion, and they also have intravascular congestion. The amniotic fluid embola, and they will also can be into the they also can, they also can occur into the enter into the medullary circulation and through the rupture of the endocervical vein. तो यहाँ पे इसी वजह से they will also can be rupture की वजह से they also can developing some there the development of this type of amniotic fluid enter within the medullary circulation. They can lead to the some form of the dyspnea, cyanosis, and also having the condition, and also coming in coma. So these are some complication or effects, and after the influence of the amniotic emboli. Now, last time we also have air, and there's the air or the some there is air or gas emboli. And there's an air embolism. Air embolism, and they will also can be occur. Air embolus, they also can occur when the air is also drawn. When the air is also can be drawn, or it also can be forced, and into they also can be forced into the circulation, forced into circulation. So these all these also the some there are the bubbles, air bubbles, these air bubbles, and they also can be act as a, they also can act as a physical, they also can act as a physical masses, and they may also can occlude the, they also can occlude the major blood vessels, and major blood vessels usually in the most probably occur in the lungs and also in the brain. They also can affecting the lung and brain. So the common causes and of the formation of air or gas emboli. So they also can during the number one, the during delivery, or the most probably the abortion. During delivery or abortion, air may also can be, maybe also can be forced into the, they also can force they also can be air also can be forced into the ruptured uterine venous system. So the also can be caused by the rupture of the uterine venous sinuses, and by the help of the by the forceful powerful contraction of the uterus. See, the contraction of the also can, the air also can be trapped, and within the uh, they also air trapped, and they also can leading to the some form of the development of the air or the gas emboli. So in patient, most probably they also can be in the pneumothorax. In the pneumothorax, an accumulation of the air within the chest wall, in the cavity, thoracic cavity, and when the large amount of the, and the very large, most probably the large artery and or the most probably of the vein, they also can be, when the large artery or the vein, they also can be ruptured, and they also can be ruptured accidentally. जब कोई accidentally कोई vein or artery rupture हो जाती है, injury to the, most probably they also can occur the lung or the lung and the chest wall cavity, and they also can may also can be open. They also can open the large vein. They also can open the large vein, and they also can permits, most probably they also can permit the air into the, and permit the air. They also can enter, and they also can occur during the inspiration. जब कोई आर्टरी या वेन रप्चर हो जाएगी, तो ये एयर जो है ना, वो दे आल्सो कैन बी इंटरप्ट and within the chest wall, and they also in the during inspiration, जब कोई सांस लेगा बंदा, तो इस वजह से they also enter, they also leading to the formation of the emboli, gas embola. So now another condition There's a Cation disease. So this is also an example of the air or the nitrogen gas bubbles. And they also can enter into the circulation. They also can lead to some complication over here. So it is also a cause. It is also called as the decompression sickness. So Cation disease. They also can call it there is a decompression sickness. So now it is also a disease or disorder. They are a kidney. They are also having they are characterized by the specific, most probably specific clinical manifestation. They are also having the manifestation, and that also can be resulting from the sudden lowering of the atmospheric pressure. ये किस वजह से हो जाए? Also can having sudden lowering of the atmospheric pressure, most probably pressure. So it is also can be occur in the deep scuba diver. तो ये also deep sea divers and also the scuba diver जो गोताखोर होते हैं बेटा, तो they also can be having their जब कोई unpressurized जो most probably occur in under the water construction, and there the construction and which also they also can be construction workers, and they also can lead to some air bubbles, nitrogen gas. They also can enter the circulation. They can lead to some complication over here. So this is also called as the Cation disease, or also called as the air embola, gas embola. जी जी बस ठीक है, वहाँ खत्म हो गया, पूरा बारह थे ना? हाँ ठीक है. Now, this is all of about the lecture of the embolism. So we also can see the some pictures.
Last lecture of the pharmacology, anemia. Anemia is defined as
so it's also the treatment of the
less quantity of hemoglobin in the blood. There are large number of anemias which occur in the human
air embola. So they also having there is some there the air and the gas embola. So they also can scuba divers.
iron deficiency anemia, pernicious anemia.
So this is also having there the fat embolus.
The reduction in number of erythrocytes per cubic millimeter in the quantity of hemoglobin or volume
Now,
red cells per 100 ml of blood occurs when equilibrium between blood loss and blood production is disturbed between blood loss and blood production. Hemoglobin per 100 ml 40 to 80 gram in male and female 12.
emerophil embola. So this is also a source of the formation of the emerophil embola during the labor.
Oxygen from the lung. Most of the students know the major function of RBs.
So this is also having there the fat embolus.
Hemoglobin, which in turn carries oxygen from lungs tissues.
So these are the some most probably some complications developing after this. So our topic was completed, and last lecture we already done the thrombosis and also the embolism. Okay. So next lecture we also going to be discussing the new topic related to the hemodynamic fluid disorder. There is the most commonly infarction. Thank you very much.
Hemolytic anemia is the result of fragile red blood cells that rupture as they pass through the capillaries. It's called hemolytic anemia, and with the RBC rupture and release hemoglobin in the tissues. Pernicious anemia, the common type of vitamin B12 deficiency anemia caused by a defect in the synthesis of intrinsic factor.
Ayo aja.
Protein required
Baru begini lecture.
vitamin